Hello, I'm John Kanellopoulos, Clinical Professor of Ophthalmology at NYU Medical School in New York City, New York, and Director of the LaserVision Institute here in Athens, Greece. It's my pleasure to introduce and try and explain to you this very simple and, in our opinion, very helpful device. The Quant is a ocular scatter measuring device, and it's quite simple. This is the actual position that the patient sits at. The patient is examined one eye at a time, so the patient is seeing monocularly through this ocular here, and this is what the patient is seeing. I'm giving you the example of the bright blinking circle, which is meant not to distract the patient, and the patient has to focus in the central tiny circle, which is split vertically in half, and at each given moment one of the two halves, either the left or the right, is brighter, flickers brighter. And this is what the patient is asked to do, is by clicking on here, left or right, to decide at each given moment while this test is being performed, which of the central circle hemimeridians is flickering brighter. We're going to go through more technical aspects, but it's a very simple test. It takes under 10 minutes to perform, and the actual raw data acquisition is about 2 minutes. It's very easy to train patients, even older patients. We have found great facility with this device in getting a better idea in post-refractive surgery patients, correlating epithelial maps obtained with OCT, cornea irregularities obtained either with Seinflug, Placido imaging, or the new Cassini device, and finally trying to see if ocular scatter has something to do with degradation of the patient's quality of vision when, if that occurs. Okay, so again, just to note that in reality, only one half of this central circle flickers, and it might be perceived by the person being examined that the other half flickers as a result of ocular scatter within the eye. So this is how this psychosomatic measurement is trying to establish the ocular scatter. Just a few caveats. The prescription of the patient can be placed here with these trial lenses for greater accuracy. And we're seeing some intrinsic measuring ability of the device to show us the reliability. Here we're seeing the curvature of normal individuals that, as you can see, is very much age dependent. So each individual is being graphed against people of their own age. We're seeing here one of our actually optometrists that had the LASIK surgery about 10 years ago. She is now in her mid-30s and has had 3 children. And you can see that the actual device shows the logarithmic normal response, the best response, the worst response, and normal is somewhere in between, preferably towards the best normal. And our optometrist scores better than the best normal for her age group, showing excellent LASIK result. So where would this test be significant? Although we don't have the discrimination by the actual test, which I need to say was pioneered by Thomas Vanderburg of Amsterdam, we don't have the definition whether scatter that occurs and is measured by this device comes from the cornea, the lens, or the vitreous, or internal reflection within the retina. But in refractive surgery patients, we assume that this comes from the cornea intervention. In a patient with complaining of poor quality of vision where topographies, wavefront, and refraction are perfect, if scatter is not good, then we have an area to look at. Perhaps an increased scatter is being created in the cornea from our laser intervention, for example. The other patients that we're studying this very interesting is the pre and cataract age patients, where we can actually see a more sophisticated method of measuring visual function. We're accustomed to measuring snellen acuity, and unfortunately snellen acuity is still by the FAA and international authorities the way pilots, commercial pilots are measured. In our opinion, this is a much more sophisticated test besides visual acuity and contrastivity to measure the degradation of visual function that depends on ocular scatter. And we can see very effectively patients after 65 that we're starting to clinically see with the slit lamp cataract development, their ocular scatter increasing quite significantly. And the preliminary data, we've been working this device a year and a half, makes us believe that this is the way that we're going to be also measuring visual function, as it is able to give us a higher level of visual function measurement. So we hope that this type of measurements will be incorporated in our routine refractive surgery and cataract surgery evaluation. As you can see, it's a very simple device. We have no financial interest, and we were investigating its application in normal patients and patients that require higher visual skills, such as professional athletes and commercial fighter pilots, and obviously in our refractive surgery population and our pre or cataract surgery population. I hope you found this brief brushing towards getting to know the Quant measuring of ocular scatter interesting. Signing out from Athens, Greece. This is John Kanelopoulos.